to Aesthetic TV. I'm Stuart Brazell, coming to you from the stage of the Aesthetic Show. We're about to enter the darker side of medical aesthetics, the realm of botched surgeries. We've all heard about people being scarred from cosmetic surgery procedures thanks to various salacious TV shows and stories that circulate online. With the growing popularity of plastic surgery, these botched procedures are happening in greater numbers to patients that are either very disappointed with their outcomes or have suffered with serious post-surgical complications. So, what should they do? To make sense of how these cosmetic surgery nightmares can occur, and more important, to put our fears about them a little more at ease, we've invited experts who have revised or corrected all types of botch cases. Dr. Stephen Hopping is a cosmetic surgeon practicing in Washington, D.C. Dr. Christine Petti, a plastic surgeon who has seen plenty of botch cases at her practice in Southern California. And we have Justin Jedlica, who is a well-known model and TV personality who has gone through countless plastic surgery procedures in his pursuit of the perfect male physique. Thank you so much for joining us.
It's our pleasure to be here. Thank you.
So one of the scariest things about botched procedures is that they can happen to almost anyone, even the rich and famous. For example, Kenny Rogers. We've seen his before and after photos, and he's very openly talked about his botched eyelid lift and how much he hates it. So why is it that some surgeries get botched?
Well, I think, sir, it's important to know that surgery is invasive and there can be complications. There can be infections. So that's part of the deal. It's not like getting your hair done. I think in Kenny's case, I think he just had a bad operation. Aesthetically, it's bad. He didn't have a paralysis. He didn't have. I mean, yes, anybody could have a botched surgery. Priscilla Presley, she went to a non-licensed practitioner in LA, introduced by her friends. She gets some sort of toxic material introduced to her face. One of the most beautiful women I think I've ever seen, and it sort of ruined her face. She has no expression. Then we have people like we recently had a death in my city, a woman who goes to a hotel in New York City to get the Brazilian butt lift to look like the Kardashians, and she dies in the hotel room. They're injecting buttocks with F.A.C.S, industrial silicone. So obviously, if you go to these type of centers, you're ratcheting up your risks of serious complications.
Well, I think that as a plastic surgeon, that you have to have a vision. When you talk to someone about their face or about their body, it's good to get it on level with them as to what they expect, so that you have a vision and can create something that looks fantastic in terms of looking refreshed and young, but also natural. And that comes from the talent, I think, of the surgeon listening, but also delivering and executing in the operating room in terms of the way you move tissue. So part of it may have been, his selection, Kenny Rogers' selection of surgeon, and part of it may have been the execution of the surgeon, perhaps, and the skills.
Sometimes bad luck.
Could be both.
A big portion of this is also in the recovery with patients.
It definitely
and the aftercare is like paramount in this. The doctor can only do but so much, and you can have a great surgery and in the end still have some things look fouled up because of the way the patient has handled the situation and not treated it as a true surgery.
I love that, because I do think the patient has to be responsible as well. Not only making the decision for surgery, but also after surgery, because I always say to the patient, it's in your hands now. I'm going to be there for you, but I can't be your babysitter.
You have to be fully committed.
Absolutely.
And I think in the case of Kenny Rogers, since we're pointing it out, I mean, plastic surgery shouldn't look plastic.
No.
Not in 2015. It should look natural.
Absolutely.
He's an example of not bad or botched plastic surgery. It's overdone plastic surgery. And we're seeing a lot more of that. People getting overfilled, over-Botoxed, and over-operated.
Right, and I was thinking about Joan Rivers, for instance. If you look at Joan Rivers, and God bless her, where she is, but the thing is that she actually looked better, I think, don't you agree, as she kind of aged and things relaxed.
Right. And that was the look she was going for. That is part of what made her famous.
A big portion of that is left up to each person's interpretation of what is beauty, right? And what the public may see as bad plastic surgery, in some cases, could be the wanted result from the individual. So it's hard to distinguish that from just looking at photos.
She may have been happy with the way she looked.
Exactly.
And there are a lot of people running around with fabulous fabulous plastic surgery, and we just don't realize that they've had anything done. I'm talking to you, Jennifer Lopez.
Yeah, I know.
I want to know, what is this woman doing? And it is a mix, but they make headlines when it's shocking, and the Priscilla Presley, I mean, my goodness, you know.
My husband will always say to me, the problem with you, Chris, is when you do the surgery, you make it look so natural that people don't have to talk about having had it done. You know what I'm saying?
Isn't that sometimes the point?
Yeah.
So I want to touch base on this topic of everyone wants a deal. Everyone wants a bargain.
So for sure.
How is that changing the landscape of how procedures are done, and what are your thoughts on, say, the Groupon facelift, things like that?
Sure. No, I think that's a big problem because, of course, price is important, but even when you're doing things like Botox, there's a lot of adulterated Botox floating around the United States, and if you go to someplace where it's necessarily cheaper, it might not be necessarily safer.
The same quality,
or the same quality, or the same potency, or it may be adulterated. A lot of Botox coming out of China. I think that this is a problem that people have to think about. Medical tourism. A lot of people on the East Coast will go to places like Costa Rica, Dominican Republic, because it's a lot less expensive. Have a little vacation. However, there's a high incidence of people going to there was a liposuction clinic in Dominica. They had 15 cases of mycoplasma infection from liposuction. That's purely from not proper sterilization of the equipment.
That's scary.
Buyer beware.
That's right.
It's referrals are paramount here, and being educated as the consumer, right?
Absolutely.
Everybody does want to feel like they have the best price, but it could also put you in a world of hurt that could lead you to spend a lot more on revisions. So, not to say you can't get a deal in some places, but it's not always the best thing, and to make sure you do your homework.
But I think there's a lot of pressure on physicians, so we have to take our responsibility. In other words, because with insurance and the way it's gone, where doctors make so much less money now and their overhead is rising. So there's so many doctors that are also trying to get into the cosmetic surgery field that are not qualified, are not trained, do not know proper anatomy, do not know proper...
They're taking like a day course, right?
Exactly. And so, we have that problem as well. And then you have the problem where patients are desperate. They're desperate, so they will go for the deal, where really they should do more research and get educated. And
Definitely.
like you said, maybe based on referrals that are solid.
But we see it all the time on the Botched TV show. I've worked on series now, 3 episodes with them, and we see it again and again and again. People who have done at-home remedies where they've done the fix a flat, or they've injected different types of polymers and things into their face, in the hopes that they're going to beautify themselves, and they cause themselves so much more agony and pain rather than really saving their money and going to a licensed accredited physician.
It's your
give them a
face.
great
I
result.
just personally, that's one thing I'm not going to mess around with.
Absolutely.
I feel that you get what you pay for.
Right.
It's true.
Right.
So you touched on this a little bit earlier, but I wanted to talk about this very famous criminal case, the Black Mama case in Philadelphia, where patients were disfigured or killed by an unlicensed practitioner. This is becoming more and more it's happening, right?
Sure. You're talking about the
Black Mamba.
the buttock injection?
Yes.
Well, there have been deaths reported now in 15 states in the United States from similar types of injections, non-licensed practitioners. And the thing of it is that probably their friends had this done and they were fine, it looked great, but if you're that 1 or 2% that has a serious complication, you're really in trouble, because many of those things, if you happen to survive, they can't be fixed.
It's hard to believe that someone would even attempt doing something like this, when it's so dangerous, it's something they're untrained for, and then to market it, not only was she a problem in terms of what she administered and what happened ultimately in terms of the death, but there were people directing patients to her. So there's a whole line of people that are in this as a business. They're in it as a business, though. This is not about the patient. This is about the business.
Well, it's massive in the LGBT community. I see a lot of transgendered individuals that I've spoken with and that are personal friends of mine, where they say pumping parties are kind of the normal, where people go and have regular silicone injections, and it's an event, and people go and meet at hotel rooms or at people's homes, and it's definitely something that's scary. And I've heard of some situations that I would never consider. But people really don't have the money, and there is
a big factor.
This need for people to be beautiful, and unfortunately, people go that route sometimes and pay the price.
Patients have asked me to do things, and I look at them sometimes when they're outlandish, and I'll say, "I'm not a cowgirl, I'm a plastic surgeon. I have a responsibility not only for
ethically,
and your safety, for your safety as well.
And
not
talking
only your
about
appearance,
this
but your safety.
tourism,
Yes.
you touched on this.
Right.
A lot of people, they are traveling to foreign countries for inexpensive treatments only to come home and have to have everything fixed. I mean, I personally knew someone who went down to Tijuana to get a butt implant, became terribly infected. It was disastrous, and she spent so much more money than if she had done it properly.
Right. The revision surgeries can be much more expensive. You're right. And I think it's important to know. Yes, I know we have this show called Botched that shows, but actually these disasters, fortunately, given the amount of surgeries done in the United States, don't happen very often. But once you're outside of the United States, where there's some sort of quality control, we don't really know. I think one of the cases in Botched that had a butt implant, it turned out it was a breast implant that the surgeon put in the butt. So,
those are two very different things.
They use a cohesive
very
silicone
different
breast
shapes.
implant.
Right. So these are the kind of things you're setting yourself up for when you go to someplace that's unsupervised, that doesn't have sort of quality control, checks and balances.
In my experience, I have taken out implants that were, I've never heard of these type of implants ever. Breast implants I'm talking about. I also have found a sponge in someone's breast as I was doing a revisional surgery. I've had to fix patients' breasts that lost complete nipple areola because of circulatory problems. I had a woman who walked around with a breast infection for 6 months, went back to her original surgeon who wasn't a board certified cosmetic surgeon, and never was treated for the infection. I sent her immediately to the emergency room, infectious disease, hopped on it, and she was taken care of. But it's very sad that these situations are existing.
And also it's about, patient relationships with their surgeon, and if you're just flying in somewhere, I'm sitting down with you and 10 minutes later I'm on the operating room, that should not happen, right?
I couldn't do it. No, I like to build up a rapport with all of my doctors that I've worked with, and the aftercare, like I said, the aftercare is so important. It's not just going and having the initial surgery.
You're so right.
It's having your doctor see you through, and when I travel, I've lived on the East Coast, all I want to do is travel to the West Coast, to California, to LA predominantly, not out of the country. But still, I always make sure that I stay 2 weeks or longer to be able to get through the surgery and make sure that I have good follow through on it.
I had a recent experience from a business standpoint where I was interviewing someone who had been my patient. She had come to me for a breast surgery, and then I was interviewing her, and she was working for one of these huge cosmetic clinics, where you're treated basically like cattle. And she was telling me that what they do is they have consultants that see the patients, they talk about the surgery, the patient is given information from a non-practitioner, a non-physician, a non-nurse.
Could it just be me giving you this
information? It could be you, yes. But
I should not be giving that information to anybody.
What's motivating you to do that? Money. That's the thing.
I had actually years ago, I found a website online. I was looking to change the color of my eye. And I found this website, and I had friends who had this done, and 2 of them had them removed, and 3 of them still had them in. And actually, I went down to Panama City. I booked this surgery through the website, and you couldn't speak with the doctor, and only with this coordinator. And then when I went down there, I got really cold feet. I started to look on YouTube and talk to more people.
These are your eyes.
I got really scared, and then I said, I don't have the referrals here. I haven't talked to the doctor, and I'm going to meet him the day of. And I got really scared. And I met with the doctor, and I decided to wait, obviously. I didn't go through with the procedure, but it was like I brought me to this place where they lifted up a garage door, and they had it like at an optometry center there, but it wasn't like an official office. I think it was almost like a rental for the day, and then they take you for the surgery for 15 minutes, and then you're finished and supposed to go home.
That gives me chills.
And I went back to try to get my money afterwards, and the doctor told me the person I was dealing with wasn't an employee of his. He only ran the website.
Oh my!
So I had to fight that.
That is nuts.
I didn't have my procedure there. I told him, I said, I'm sorry, I'm going to have to wait. I just got too scared. I was giving myself migraines, you know, just thinking about this process.
And anytime you go into something with that much angst, you're not going to be relaxed,
right.
you know.
No. But you know, I think that in today, with the social media effect, I mean, this kind of thing is very possible. I mean, people can advertise and they can reach out to people in the United States everywhere, from offshore. There's no control.
I mean, you can send a tweet and who knows who's going to be your patient.
So I think that patients need to, first of all, what do we tell patients? I mean, get a few consultations. You know, make sure that everybody's pretty much telling you the same things, number one. Ask to see their work, okay? Hey, check them out on social media. There's, you know, go to Real Self. You can really find out a lot about people. You know, we surgeons kind of hate this thing, but you know what? To be honest, it's very patient friendly. It helps the patient select their doctors. I mean, if somebody has only bad comments, then, well, that doctor's really not giving the kind of service he should be. And
I also like
and I think
Facebook.
people should keep it use that. Yes.
Believe it or not, because I do think that, you know, it gives you a flavor of the color of the physician as a human being.
Right.
You know, what they put on their Facebook page and what is said about them, you know?
Absolutely.
But I think actually social media, as much as the medical profession doesn't like it, I think it makes us better doctors. I think
do
every
too.
time
I like that.
I do too.
And it's had a very positive response, I think, and doctors who say, oh, there's nothing wrong with you, there's not a problem. They're not so quick to say that now. They're more sensitive because people have paid money. If they're not happy with it, you need to address that. You can't just blow it off. You can't tell Kenny Rogers, oh, you look fine, when Kenny Rogers looks like a girl.
And he doesn't feel, he
Right.
wants to feel good about himself.
Yes, fix it. My philosophy with patients who are unhappy is refund or reoperate.
I like that. I want to talk too about this uptick in things that are being sold on the black market that, you know, we talked about Botox, but
right.
There's a lot of stuff being sold that is claiming to be legitimate that isn't on the black market. Have you come across this in any of your procedures, or do you have stories about this?
Well, we all know that patients have been treated with other types of medications than Botox. I mean, there's many, many different types of Botox. I've also seen patients that are treated with deoxycholine that have had some horrible results, you know, in terms of fat injection to dissolve fat. And I mean, I think we've all seen some disasters. I try to avoid them. I mean, those people don't get into my office, and I would not bring anything into my office or use a product that on a patient that I would not use on myself.
That's key.
Yeah.
So we've been talking a lot about botched patients, but I want to talk about the patients who keep coming back, and it never seems to be enough. Right. Sometimes it's used the term body dysmorphia. Tell me about your experience with these type of patients.
Well, I think it's a big problem, and I think as surgeons, we have a huge responsibility to say to somebody, hey, enough is enough, or you really don't need this, or the time. It's actually very difficult as a surgeon to turn people away in a way that's
disappointing.
It's disappointing, but so what I say to them, I said, look, you know what, there's only going to be a 2% improvement here. It's just not worth a 2% improvement. Or I say, you know what, you're not ready, timing is everything, let's talk about it next year. But they could go somewhere else.
It has to come from, I mean, you have to interview your patient, I would assume. I mean, I'm not a doctor, but every time I go, I mean, obviously I'm accused of this all the time on television.
Yes.
Because I'm such an enthusiast of plastic surgery. But I think it's really up to the doctors to screen the patients and see what is the motivation behind this. What is this person expecting this is going to do for them, and are they realistic in what they're attempting to pursue?
Right.
And then it is, of course, your decision whether or not you choose to partake in that. As some of my doctors that I've gone to choose to pass, and other ones will say, sure, I'm willing to take on something a little bit more extreme. But I think at the end of the day, they realize that I'm somebody that's a healthy patient to work on. And I mean, in the consulting that I do, I mean, I've definitely run across people that come in and they ask for things that I don't necessarily see any need to change, and the wants that they express are things that I couldn't even give them a referral to a doctor to achieve. So it definitely exists where you have to deal with those people, and it's heartbreaking because a lot of times they genuinely see a flaw or a defect that's not there. There would be no satisfying that patient.
What they see in the mirror is not what everyone else sees.
Right.
Correct.
Right.
So, you know, and I think patients are very hard on themselves. I always see more beauty in every one of my patients than they see in themselves. People tend to focus on the negative. You know, you've got that 10x mirror, and they're saying, you know, look, don't you see how one eye is smaller than the other? I said, no, I really don't see that, and it's not fixable. And you know, we're looking at your energy, your overall look. It's our job to coach them and point out to them their positive things.
No one is perfectly symmetrical. We're human beings.
Absolutely
Thank
true.
God.
You can't make someone happy through surgery. You know, that happiness has to come from within. The surgery itself can bring out so many, you know, beneficial things in terms of how they feel about it, and so much self-esteem and confidence, you know, like you've experienced, which I think is probably why you have continued to have surgery. And that's an individual thing.
Definitely, yeah. I mean, it's grown, and it's grown in me over the years, you know, the ability to be able to realize that I own my look and my aesthetic, and I think the changes that I've acquired in my own look is something that I feel the clout from, I feel the confidence from, and even if other people don't necessarily see those little tweaks, it's something that I'm proud each time to be able to show off.
As long as you're happy, that's good.
It's almost become like, I guess some people buy their Louis Vuitton bags or their Chanel suit, and I choose to modify my body in that way. So it's an exciting way for me to be able to express myself. It's an art form.
And a take off from what he's saying, that you buy a Louis Vuitton. I think that our society is buying a nose and buying a certain look, and you know, they're going in and perceiving cosmetics as something that you buy. It's retail. It's become retail, which I think is a problem for us as physicians, because we're trying to make ethical decisions, and we have a person's face and a person's body. It's so serious.
You can return that Prada bag if you decide you don't want it.
Don't you think patients use plastic surgery as a tool all the time to better themselves, whether it's a goal that they're working towards or it's something that they feel is going to help them further themselves in their career or their personal life and give them that confidence and that boost? And that is something that I would assume you would agree with.
Yes, I definitely agree with that, but I do think that they have to see that it's serious, that there are risks, you know, and that they have to understand.
It's not a status symbol.
Yes.
Right, but you know, there are many positive things that plastic surgery does for people, but we can't promise that. But we see it all the time in 16-year-old girls who have their father's nose. You give them a small nose, it changes their life. It is life-changing. We never promise that, but we see it all the time.
Or women that have the 16-year-olds that have the large breasts that cannot exercise, can't be athletic at all.
Right, but our patients there, they're bombarded with, you know, this, you know, we adore beauty and youthfulness, and like the thigh gap. That's a big thing. It's ridiculous. There are websites that teach you how to get thigh gap.
And let's talk about how most of those thigh gaps are photoshopped.
Photoshopped, exactly. People have to know this. I have women coming in. There's no way they're ever going to have thigh gap.
No.
I mean,
you know, I hate these coined terms too. The coined terms.
And next year it'll be something else.
Yeah, I mean, you know, when a patient comes in and they say a boob job or nose job, I try not to use that, you know, as a term as well, because I think that, I don't know.
So you would want to say rhinoplasty, not nose job.
Yeah, or I'm going to contour your nose, or I'm going to do a breast. I don't like to
more
call
like
breast
a nose
boobs.
job.
Sorry.
Sounds more throwaway,
because
like
more
no big
the
deal.
stereotype of what typically a nose job would.
Well, I just want it to be serious. I want it to be serious.
Now, at what point is it the surgeon's responsibility to say no to the patient?
It's always the surgeon's responsibility to be able to, you know, part of being a great surgeon, as you know, is the selection process.
Sure.
And that's, I think, a success of my practice, and I'm sure yours as well, is who you operate on and who you don't. So I think that, yes, being able to say no. I had a woman once who came in, she wanted her face done, and then my patient coordinator came to me and said, Dr. Petti, now she wants to add the nose. And then like a week later, she called and said that she didn't want the face or the nose, she wanted the breast. So I had to meet with her. Now I had collected, it was a cosmetic surgery, so the patient prepaid. I had her money there, she had prepaid. But I said, I cannot operate on you because you keep changing what you want to have done.
It's not like, here's what's in the bank, put
you
it towards whatever you feel like that
So here's your money back. I can't operate on you. And you know what, I have to tell you, within 2 days, I had a call for her medical records, and she had surgery by someone else. Like you were saying, you can go out the door and they'll find someone else just like that.
Well, as I said, it's hard to tell people no, but I think, and you're probably the same, at least 1 out of 3 patients, I say either you're not ready, or you don't have the indications, or you're not going to get enough benefit. And this is surgery, and there are complications as we find out. So the benefits should be way up here, the risks should be way down here. If they're like this, red flag.
Maybe if someone said no to Michael Jackson, we would still have him here, and I would love to still have the benefit of having Michael Jackson.
Sure.
It's so sad.
Yes, absolutely.
That's a great point. Well, clearly when it comes to botched procedures, sometimes it's the doctor's fault and sometimes it is the patient. So buyer beware and do your due diligence. Make sure to get good references before you choose a surgeon. And you can find out more information at aesthetichtv.com. Remember, knowledge is power. And the more you know, the less of a chance you will end up scarred and scared. I want to thank our expert panel for helping us understand this issue. You were all fabulous today.
Thank you so much, Stuart.
Yeah,
Thank
Stuart,
you. And for Aesthetic TV, I'm Stuart Brazell. Stay tuned and stay beautiful.